Hello, and welcome to Medicare 2024. This seminar is brought to you by the Artists Health Insurance Resource Center of the Entertainment Community Fund. First, just a few words about the fund, a national human services organization which many of you may know by our former name, the Actors Fund. What is the Entertainment Community Fund? The fund fosters stability and resilience for performing arts and entertainment professionals of every kind, providing a safety net for them over their lifespan. Our services encompass social services and financial assistance, health insurance counseling and a health center, housing, including a nursing home, a career center, and much more. We encourage you to visit our website, entertainmentcommunity.org, to explore the full range of seminars and assistance we offer. This seminar is designed to make you familiar with Medicare. By the end of our seminar, you will understand what each of these terms means and how they interact. Original Medicare, Medicare Supplement Plan, Medicare Prescription Plan, Medicare Advantage Plan, Initial Enrollment Period, and Special Enrollment Period. What is Medicare? Medicare is basically a giant group health insurance policy. It's for people 65 and over, for people under 65 with certain disabilities, and people of any age with end-stage renal disease. When does Medicare begin? For people just turning 65, Medicare begins the first day of your 65th birth month, unless your birthday is the first day of the month. In that case, Medicare will begin the first day of the month prior to your birthday. For people eligible because they are collecting Social Security Disability or SSDI, Medicare begins 24 months after you start collecting SSDI. How do I get started? If you're already collecting Social Security benefits at 65, you'll be automatically enrolled in Medicare and will receive a Medicare ID card in the mail. If you're not already collecting, and most people aren't because the Social Security retirement age is no longer 65, you must proactively enroll in Medicare. Nothing will happen automatically. You will have 7 months to do it. That 7 months is called your Initial Enrollment Period, or IEP. Your initial enrollment period begins 3 months prior to your birthday month, includes your birthday month, and the 3 months following, so 7 months total to enroll yourself in Medicare. Here's a timeline graphic showing how IEP works. You can start your enrollment in any of the 3 months prior to your birthday month. However, Medicare won't start until the first day of the month you turn 65. If you wait until your birthday month to enroll, or any of the 3 months thereafter, coverage will start the first of the month following the month you enroll. So, if you want your Medicare to begin the month you turn 65, you must enroll in the 3 months prior to your birthday month. During IEP, you can join Part A, Part B, a Medicare Advantage plan once you have Part A and B, and Part D if you have Part A or Part B. You can also buy a Medigap policy once you have Parts A and B. The enrollment period for a Medigap lasts for 6 months from when you are both 65 and have started Part B. We'll go over each of the above terms in more detail later in the webinar. There are a few ways to enroll in Medicare. You can go online to ssa.gov, which will guide you right through the steps to enroll in A and B. If you're comfortable online, this is a fairly straightforward process. Or you can make an appointment with your local Social Security office and enroll in person. Enter Find My Local Social Security Office in your web browser to find the closest one. What are the different parts of Medicare? Part A, which is hospital inpatient insurance, Part B, which is insurance for all the other types of medical services. Parts A and B together are what make up Original Medicare, the official term for Medicare administered by the government. Part D, which is prescription drug coverage, a separate insurance plan offered by private insurers. Medicare Supplement or Medigap plans, which also offer an additional insurance covered by private carriers, which wraps around your original Medicare to cover copays and deductibles. And finally, Medicare Advantage plans, also referred to as Part C, which are an alternative to original Medicare. Part A covers 4 basic services: inpatient hospital care, skilled nursing facility stays, also called subacute care or rehab, following a hospital stay of at least 3 full days, home health care, which is limited to short-term clinical assistance at home after release from a hospital or rehab, and hospice care, which is home-based care for the terminally ill. There are 3 costs in Medicare to be aware of: a premium, which is a monthly fixed cost that you pay to participate in a plan; a deductible, which is the amount you must first pay out of pocket before your Medicare benefits kick in; and a copay or coinsurance, which is your share of the cost of a specific medical service you receive or a prescription you fill. For Part A, there is no premium for anyone who has worked at least 10 years in the U.S. However, Part A has a sizable deductible. In 2024, it's $1,632. Please note this is not a one-time annual deductible or a per admission cost. It is per benefit period. That means the deductible will cover multiple admissions or readmissions to hospital and rehab facilities within a 60-day period. If there is more than a 60-day gap between admissions, you will have to pay another deductible. So it is unusual, but possible to have more than one Part A deductible in 1 year. That deductible will cover you at no cost for up to 60 days in a hospital. You'll then have a day rate for days 60 through 100. You are also covered for a skilled nursing facility stay at no cost for the first 20 days of each benefit period, provided that your stay in a hospital was at least 3 full days and your doctor has prescribed a period of rehab before you return home. Medicare Part A will cover a portion of the rehab cost for the remaining days 21 through 100 of each benefit period, but you will have to pay a fairly steep copay of $204 per day for that period. That 20-day coverage is not an arbitrary figure. It was arrived at by actuaries who determined that 20 days was the maximum required for most rehab patients. Part A will cover the cost of visiting nurses or occupational and physical therapists to monitor your wound care, mobility, and safety at home. Hospice care at home for patients with a life expectancy of 6 months or less is covered under Part A at no cost. There may be a nominal charge for pain medication. If the patient or patient's family requests respite care at an inpatient facility, you'll pay 5% copay of the Medicare amount. Generally, however, doctors, nurses, and social workers come to the patient's home to provide hospice services. What does Part B cover? Part B covers every other type of medical service other than the inpatient hospitalization, beginning with primary care and specialist office visits, mental health care, most preventive and screening services, and outpatient procedures like cataract or other outpatient surgery. It will cover durable medical equipment such as crutches, wheelchairs, etc. Durable medical equipment requires a prescription from your doctor and must be purchased from a provider contracted with Medicare. Again, Part B covers only a limited amount of clinical home health care to ensure your safety at home immediately after a hospital or rehab release and to assist in your transition to outpatient or self-care. There is no, quote, custodial care. That is, no assistance such as cleaning, shopping, etc., covered under either Part A or Part B. Most lab services and diagnostic tests are covered, as well as diabetes supplies and self-management training. There are other services too, but they're too numerous to mention here. What does Original Medicare cover? The Medicare website, medicare.gov, is a good resource. It's an encyclopedic resource and provides a comprehensive list of all services covered under both Parts A and B. When you enter medicare.gov in your browser, you will see numerous links come up. Make sure you click on the entry that says specifically Official Government Website for Medicare. It's important to know what Part B does not cover. Long-term care is not covered either by Part A or Part B. It must be purchased primarily through private insurers. If you're financially eligible, however, you may get long-term care paid for by the Medicaid program. There are no routine dental, vision, or hearing aid services under Part B. Part B will cover specialist eye care visits only if they are mandated due to diabetes, glaucoma, or cataracts. Acupuncture coverage is limited to chronic back pain. No cosmetic surgery of any kind is covered. What are the costs associated with Part B? In 2024, for individuals whose income is $103,000 or less per year, or couples filing jointly with an income of $206,000 or less, the monthly Part B individual premium is $174.70. For those with incomes above these thresholds, Social Security imposes a surcharge called IRMA, Income-Related Monthly Adjusted Amount, on the Part B premium. That surcharge varies according to the amount of your income that is over the threshold. You'll be notified directly by Social Security if they think you should pay the surcharge. These surcharges can be appealed. Part B has a one-time annual deductible of $240. This means that the first $240 worth of services you receive after you join Part B, you must pay for out of pocket before Medicare copays kick in. This deductible is unfortunately not prorated. No matter what time of year you first enroll in Part B, you'll have to satisfy the full annual deductible before Medicare will cover any services. Once you've met the deductible, Medicare will cover 80% and your copay will be 20%. Exceptions to the 20% cost share include certain lab services and many preventive and screening services such as colonoscopies and mammograms, which are 100% covered by Medicare. Again, Medicare's website, medicare.gov, contains a comprehensive list of services that are covered at no cost to you. The enrollment period for Part B is the same as for Part A. However, if you're still working at age 65 and are covered under a group health plan based on current employment, you can defer Part B without penalty and will have a special enrollment period called a SEP to sign up for Part B after your initial enrollment period has passed. as long as you or your spouse are still working and you are covered by a group health plan through your employer or union. In that situation, you have an 8-month SEP to sign up for Part B that starts at one of these times, whichever happens first. The month after your employment ends or the month after the health insurance through your current employment ends. Again, whichever happens first. 2 important things to note. Although you have 8 full months to enroll in Part B without penalty after your group coverage ends, you'll want to time your enrollment so that Part B will be effective in that first month after you lose your group coverage. If your job loss or loss of insurance should happen while you are still within your 7-month initial enrollment period, you must join Part B before your IEP ends. You will have to pay a penalty if you turn 65, are not working, and or have no group health insurance from current employment, and do not sign up for Medicare during your 7-month initial enrollment period. Or you deferred Part B because you were covered by your work group plan and at some later point you lost that coverage and were eligible for your 8-month special enrollment period, but you failed to sign up during that time. The penalty is 10% for each full 12-month period that you could have signed up and didn't. Here's a simple decision tree to help you decide whether you, as a working senior, should enroll in Part B. You're turning 65. Are you just covering yourself? If the answer is no, then you would stay on your work plan and defer Part B. Medicare is individual coverage only. There's no way to cover dependents on Medicare. If the answer is yes, ask yourself if the work plan costs less than the Part B premium and whether the work plan is as good as Part B. If the answer is no, then get both Parts A and B and look into your other Medicare options. If the answer is yes, then stay on your work plan and defer Part B. Note, however, that it costs nothing to join Part A, and already having Part A generally makes the process of enrolling in B easier. The only reason to defer Part A would be if you maintain a health savings account called an HSA and you want to keep it. You may not join Medicare Part A as long as you have an HSA. Those of you just aging into Medicare are or will be getting bombarded with flyers and communications from Medicare healthcare plans, which appear to be endless choices and decisions you need to wade through. In fact, you have only 2 choices for how you get your Medicare coverage. You may stay with your enrollment into Original Medicare Parts A and B, and then add a separate D or drug plan, and consider adding an additional Medicare supplement or Medigap plan. Or you may replace your original Medicare Parts A and B with a Medicare Advantage plan. That's it. Only 2 basic paths to choose from in Medicare, and they are mutually exclusive. Part D is prescription drug insurance. Unlike Parts A and B, which are government administered, Part D plans are sold only through private insurance companies, which offer many plans to choose from. The best plan for you depends primarily on what drugs you take. Part D plans generally include all 3 of the Medicare cost factors. They have a monthly premium. There is a deductible for branded drugs, which you must satisfy out of pocket before your plan kicks in, and with the exception of some generic drugs, you will pay a copay whenever you fill a prescription. As you can see, you have multiple factors to consider when choosing a drug plan. Here's a quick look at average Part D costs across the country. Average premiums are $55 a month, but there are plans with premiums as low as $3 or $4 a month. Deductibles can't be more than $545 per year. This does not apply to generic drugs, only to brand name drugs and specialty drugs. Copays, which vary depending on the cost of the drug, on the tier in which the drug falls, and on whether the prescription is filled at a preferred pharmacy. Once again, the Medicare.gov website provides invaluable assistance in finding your most appropriate drug plan. Its Medicare Health and Drug Finder tool will look at the drugs you've entered into their database along with your zip code and search for all the plans in your area that cover the drugs you take on their formulary, and then sort them for you in cost-effective order by premium and copays. Medicare supplement plans are also known as Medigaps because they fill the gaps in Medicare by covering the costs to beneficiaries that are associated with original Medicare benefits, such as copayments, coinsurance, and deductibles. There are 8 federally standardized plans to choose from, identified by letters A through N, which cover some or all of these patient costs. Each standardized Medigap policy must offer the same basic benefits, no matter which insurance company sells it. To repeat, the premiums charged by carriers offering the same lettered policy, an N plan for instance, vary, but that is the only variable. By law, every carrier offering that N plan must provide the exact same coverage as any other carrier offering it, even if they charge a different rate. So when you decide on the particular letter Medigap policy you want, you'll generally look for the insurance company offering it at the lowest premium. You have the right to buy a Medigap plan during the 6-month open enrollment period, which starts the month you turn 65 and have enrolled in Part B. You may buy any Medigap plan you want at the preferred price without regard to any pre-existing health conditions. After the initial open enrollment period, your right to buy a plan varies by state. In New York and New Jersey, you may buy a Medigap at any time, any month of the year, but once the open enrollment period has passed, there may be a waiting period of 6 months before the plan will cover costs related to pre-existing conditions. In New York, you can also change plans at any time with no waiting periods. A Medicare Advantage plan is insurance administered by a private insurance company like United Healthcare, Blue Cross Blue Shield, etc. The carrier has entered into a contract with the government to take over your Medicare benefits. Carrier must give you the same or equivalent benefits that you have under original Medicare and can't charge you higher copays than you have under original Medicare. You must enroll in Parts A and B first before switching to an Advantage plan. Once you join an Advantage plan, you still have Medicare, but your coverage is no longer being provided by the government. Unlike original Medicare, which allows you to go to any provider in the country who accepts Medicare, Advantage plans have a network structure. There is a network of doctors who have agreed to participate in the Advantage plan. If you enroll in an HMO, you can use only those doctors in the network, or you will not be reimbursed. If you enroll in a PPO, you can go outside your network, but it will cost you a great deal more. All doctors who accept Medicare are required to take your Medicare insurance Parts A and B and Medigap insurance anywhere you go in the country. This is different than with Medicare Advantage plans. No Medicare doctor is required to participate in any Advantage plan. So, if the Advantage plan is giving you the same benefits as original Medicare and there are network restrictions, why would you choose it? The first advantage is that the Advantage plan generally includes a Part D plan, so it covers A, B, and D for you. Then, in addition to covering all services that original Medicare covers, it generally offers other services not included under original Medicare, such as routine dental, vision, hearing aids, etc. Finally, most Advantage plans have no additional premium of their own. Often the only fixed cost you have with an Advantage plan is your Part B premium. Therefore, the plan is generally cheaper. Average Advantage plan costs across the country for some common services are $10 for a primary doctor office visit, $40 for a specialist office visit, $90 for an ER visit, and $225 for an ambulance. With regard to hospital coverage, Advantage plans function differently than Medicare Part A. Part A has a benefit period deductible of $1,632, which could cover multiple admissions and readmissions. Advantage plans have a per admission daily rate. For example, $350 per day for up to 5 days, and then no further charge. So a 2-day stay would cost $700, certainly less expensive than Part A's $1,632 deductible. But if you had to be readmitted to the hospital the following week or multiple times, the day rates would apply each time. Actuaries have studied these two different cost structures and determined that on average, patients come out about the same on costs whether they are under Part A or in an Advantage plan. The initial enrollment period for an Advantage plan and for Part D is the same as for Parts A and B. If you do not enroll in these plans within your initial enrollment period, you'll have to wait until the Medicare open enrollment period, which is the same every year, October 15th to December 7th. Plans enrolled in during this time will have an effective date of January 1. Although there is no written requirement to enroll in a D plan during your initial enrollment period, if you decide not to the first year and then want to enroll the second year, there will be a late enrollment penalty of 1% of the national average Part D premium, currently 55 cents, for you every month you delayed enrollment and had no other drug coverage. This penalty is added permanently to your monthly drug plan premium once you do enroll. Therefore, even if you are not taking any drugs when you first age into Medicare, we would advise you to enroll in a drug plan. Look for a plan with the least expensive premium in your area, and that will be your best choice. Before you enroll, check with all the doctors most important to you to make sure they accept Medicare. Specifically, do they accept what's called Medicare assignment? This means the doctor has agreed to accept the Medicare payment as full payment for the service. If they do not accept Medicare assignment, they can charge you up to 15% more. If you're interested in an Advantage plan, again, speak to the doctors you want to keep and find out from their business office which Advantage plans they participate in, if any. Then you can limit your search for an Advantage plan to the ones you know your doctors practice in. If you're new to the area or are not strongly attached to any doctors, then you can search more freely among all the Advantage plans in your area. Never enroll in an Advantage plan without checking to make sure that your critical doctors participate in its network. Before choosing a Part D plan, Take advantage of the government website, Medicare.gov, to find the plan with the most comprehensive, lowest cost coverage for your drugs. Never choose a drug plan by a single factor like lowest premium. 4 factors: whether your drug is on the formulary, your premium, your deductible, and your copays play an important role in determining your optimal choice. Finally, if you'd like more information or assistance with your Medicare decisions, please feel free to schedule a one-on-one consultation by filling out a brief form at entertainmentcommunity.org/AHIRC. We'd like to familiarize you with some of the Medicare.gov screens and capabilities. Once you have your Medicare ID number, you can create your own personal account on this site. We would recommend that. These next 2 slides indicate how to find and compare different types of providers by entering your location and how to select a provider type to learn more about them. On this screen, we've searched for providers to learn whether they accept Medicare assignment. Note that a wealth of detail appears on the provider, including a green check mark that assures you the provider accepts assignment. On this screen, note the red question mark below the doctor's name. It means you'll need to speak directly with that physician to determine whether they accept Medicare assignment. This part of the site gives you the invaluable health and drug plan finder. This part of the site reviews the 2 basic options you have for Medicare coverage: Original Medicare plus a Medigap and Part D plan, or a Medicare Advantage plan. This part of the site helps you delineate your search preferences. This part of the site explains the details required from you to investigate drug costs. This part of the site shows you how to enter your prescription drug details. This part of the site shows you how to finalize your drug list. This part of the site shows you how to designate your preferred pharmacies. This part of the site shows you all the available Advantage plans in your area, again, with your most cost-effective options listed first. This part of the site shows you how to filter the plans using the green button on the upper right side of the screen. It allows you to narrow the list only to certain insurance companies, only to certain types of plans, by star ratings, or even by benefits that are most important to you. And that concludes our session today. Please do use the link to our intake form below if you would like to sign up for a one-on-one consultation with the fund's Medicare specialist. That link is entertainmentcommunity.org/AHIRC. Thank you for your attention and welcome to the wonderful world of Medicare.